Hello and welcome. Today we're going to explore a chronic liver disease called primary biliary cholangitis, or PBC. We'll delve into what causes it, how it affects the body, and what can be done to manage this condition. The exact cause of PBC remains unknown, making it a somewhat mysterious disease. However, it's considered an autoimmune disorder, meaning the body's immune system mistakenly attacks healthy cells. In PBC, the small bile ducts within the liver are the primary targets of this immune attack. While we don't know what triggers this autoimmune response, genetic predisposition and environmental factors are thought to play a role. Some studies have also explored a possible link to prior infections, but more research is needed. So, what exactly happens in the liver with PBC? The immune system targets and damages the small bile ducts. These ducts are responsible for transporting bile, a fluid produced by the liver that aids in digestion, particularly of fats. As the bile ducts are damaged, bile begins to back up in the liver. This build-up, called cholestasis, causes inflammation and further damage to the liver cells. Over time, this chronic inflammation can lead to scarring, known as fibrosis, which can eventually progress to cirrhosis, a severe and potentially life-threatening stage of liver disease. PBC is a relatively rare condition, affecting primarily women. It typically manifests between the ages of 30 and 60. While it occurs worldwide, prevalence rates vary somewhat across different geographic regions. Some studies suggest a higher prevalence in Northern Europe and North America. The early stages of PBC may present with few or no symptoms. However, as the disease progresses, several symptoms may appear. These commonly include fatigue, which can be quite debilitating, and itching, or pruritus, which can be severe and significantly impact quality of life. Other symptoms may include dry eyes and mouth, skin darkening, and pain in the upper right abdomen. As the disease advances, signs of liver damage, such as jaundice or yellowing of the skin and eyes, ascites, or fluid build up in the abdomen, and edema, or swelling in the legs and ankles, may also develop. Diagnosing PBC typically involves a combination of blood tests and, sometimes, imaging studies or a liver biopsy. Blood tests will look for elevated levels of liver enzymes, particularly alkaline phosphatase, or ALP, and the presence of antimitochondrial antibodies, or AMs, which are found in the majority of people with PBC. Imaging tests, such as ultrasound CT scans or MRI, can help rule out other liver conditions and assess the overall health of the liver. A liver biopsy, where a small sample of liver tissue is examined under a microscope, can confirm the diagnosis and help determine the stage of the disease. While there aren't distinct classifications or types of PBC in the traditional sense, the disease is often staged based on the severity of liver damage observed through liver biopsy. These stages range from mild inflammation to advanced cirrhosis. While there's currently no cure for PBC, there are treatments available to help manage the disease and slow its progression. The primary medication used is ursodeoxycholic acid, or UDCA, which helps improve bile flow and reduce liver inflammation. It's most effective when started early in the disease process. Other medications may be prescribed to manage specific symptoms, such as antihistamines for itching and artificial tears for dry eyes. In advanced cases of PBC that have progressed to liver failure, a liver transplant may be necessary. Lifestyle modifications, such as avoiding alcohol, maintaining a healthy weight, and following a balanced diet, are also important for managing the disease. Because the cause of PBC is unknown, there are no definitive ways to prevent it. However, avoiding potential liver toxins, such as excessive alcohol consumption, and maintaining a healthy lifestyle can help support overall liver health. The prognosis for PBC varies depending on the stage of the disease at diagnosis and how well the disease responds to treatment. With early diagnosis and treatment, many people with PBC can live for many years with a good quality of life. However, if the disease progresses to cirrhosis, the prognosis is less favorable. Recent research is focused on identifying the underlying causes of PBC, developing new and more effective treatments, and improving methods for early detection. Some promising research is exploring new medications that target the immune system and protect the bile ducts from damage.